Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what I bring to you all from the world of medicine. Sleep apnea being more prevalent in postmenopausal women. According to a new study published this week in the open access journal PLOS ONE, middle-aged women with low levels of estrogen and progesterone are more likely to snore and to report symptoms of obstructive sleep apnea. The prevalence of obstructive sleep apnea is reportedly higher in women with after menopause. However, no population-based study has previously examined whether this is the result of an altered sex hormone level. Now, in the new study, the researchers analyzed data from close to 774 women aged between 40 to 67 years. Women in the study, they participated in questionnaires on their respiratory health, women's health factors, lifestyle, sleep, and also gave blood samples for hormone analysis. It was then observed that 71.2% of the women in the study were told that they snored, and 411 of those women also reported other symptoms of sleep apnea. Now, among all the women, a doubling of serum concentration of estrogen was associated with 19% decreased odds of snoring. Also, a doubling of progesterone levels was associated with a 9% decreased odds of snoring. While among the snorers, a doubling of the concentration of 3 estrogens was associated with 17 to 23% decreased odds. And these women have been told that they breathe irregularly during their sleep. While the doubling concentration of progesterone among the snorers was associated with a 12% decreased odds of having woken with a choking sensation in the previous year. The authors hence concluded that adjusting the female sex hormones might be a strategy to decrease the higher prevalence and also the associated morbidity of obstructive sleep apnea. Acupuncture as the effective means of treatment for chronic headache. Tension-type headaches often present with a pressing or tightening feeling on both the sides of the head with mild to moderate intensity. Now, these headaches are not worsened by physical activity and even do not include nausea. Now, tension-type headaches are considered very chronic when they occur at least 15 days per month. Now, as per a new study published in the Neurology Journal, acupuncture may reduce such headaches for people who have chronic tension-type headaches. Now, the study involved close to 218 people who were diagnosed with chronic tension-type headaches. They had these type of headaches for an average of 11 years and had 22 days per month with headaches on average. The participants were randomly assigned to receive either true acupuncture or a superficial acupuncture. The acupuncture treatments involved achieving a Dekai sensation, which involves placing and moving a needle in the body to reach either a tingling sensation, a numbness or heaviness feeling, while the superficial treatments, they had a lesser depth in the body to avoid achieving the Dekai sensation. Both the groups, they received 2 or 3 sessions per week for a total of 20 sessions. This happened for 2 months and were followed for an additional 6-month period. The main result measured in the study was a reduction of at least 50% in the number of days with headaches. At the end of the study, 68% of the people receiving true acupuncture reported at least a 50% reduction in the monthly number of headache days compared to 50% of the people who received superficial acupuncture technique. The researchers found that the number of monthly headache days gradually decreased after treatment in both these groups, that is, those who received true as well as superficial acupuncture treatments. So it can be said that acupuncture may help in reducing headaches. How virtual reality training can help to cope up with psychosocial stress. Previous research has described how virtual training produces acute cognitive and neural benefits. Now, building on those results, a new study suggests that a similar virtual training can also reduce psychosocial stress and anxiety. Researchers from the Tohoku University's Smart Aging Research Center published their findings in the International Journal of Environmental Research and Public Health. Now, we all know that physical exercise benefits our overall well-being. But for some, such as neurological patients in particular, people suffering from cardiovascular disease and even hospitalized patients, physical exercise usually is not feasible or can be even considered very dangerous. However, similar effects may be brought about when using the immersive virtual reality. Now, despite initially designed for entertainment, this immersive virtual reality has attracted interest from the academic community as well, mainly because of its potential use for clinical purposes, since it allows the user to experience a virtual world through a virtual body. Now, in the current study, the researchers explored the effect on stress adding another level to the beneficial effects of virtual training. Young, healthy subjects, while sitting still, experienced a virtual training displayed from the first-person perspective, creating the illusion of ownership over movements. The avatar that they created ran at 6.4 kilometers per hour for 30 minutes. Before and after the virtual training, the researchers induced and assessed the psychosocial stress response by measuring the salivary alpha amylase level, which is the crucial biomarker indicating the levels of neuroendocrine stress. The results showed a decreased psychosocial stress response and lower levels of anxiety after the virtual training, comparable to what happens after the real exercise. While a moderate amount of exposure to stress might be beneficial, repeated and increased exposure can be detrimental to health. This kind of virtual training represents a new frontier in countries where high performance demands and an aging population are in abundance. Artificial intelligence use in interpreting dental X-rays. Previous studies have examined the use of artificial intelligence to detect caries, root fractures, and apical lesions, but there is limited research in the field of periodontology. But according to a recent research that was presented at the Euro-Perio 10, a deep learning algorithm successfully detects the periodontal disease from 2D bite-wing radiographs, meaning the study evaluated the ability of deep learning technique, which is a type of an artificial intelligence, to determine the periodontal status in bite-wing radiographs. The study used 434 bite-wing radiographs from patients who had previous history of periodontitis. Now, the image processing was performed with a U-net architecture, which is usually a conventional neural network which is used to quickly and precisely segment these images. Now, the assessments include the total alveolar bone loss around the lower and the upper teeth, horizontal bone loss, vertical bone loss, furcation defects, and calculus around the maxillary and mandibular teeth. Now, based on the results, the study illustrated that artificial intelligence is able to pick up many types of defects from 2D images, which could aid in the diagnosis of periodontitis. Hence, this study provides a glimpse into the future of dentistry, where artificial intelligence automatically evaluates the images and assists the dental professionals to diagnose and treat the disease at a very early stage. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.